In the second part, we'll discuss about the how to assess the seriousness of the disease, how high the fever is, how to give the medications. These common things we will discuss in this part. Now let us see how to assess. Now my child has fever. Should I run to the hospital immediately? For a very small baby, less than 2 months of age, fever, especially high fever, is always a concern because their immunity is just developing. So it is better to get the baby assessed. As the baby grows older, you can always observe for more signs and symptoms and give yourself more time for evaluation. So an older child at 1 year gets a fever. Of course, you can give a fever medicine, watch the baby, and if there are concerns, go to the hospital. What are the situations where you are really concerned about? When there is a fever which is difficult to control with both paracetamol and ibugesic, it's preferable that you get an early assessment for the child because most of the time with 2 medications your fever does come down. Now you gave the medicines, the fever came down, but you find the child is not active, not playful. In general, children, it's very difficult to keep them quiet and sitting somewhere. They are always active and playful, running around. They very rarely lie down. So the height of temperature, even if the child is a little dim, the moment the fever comes down, they start playing again. So if you find your baby is looking very tired, preferring to lie down, not going around to play, again, it's better to get baby assessed. Especially if the head is not kept straight, wants to lie down on your shoulder, definitely make sure that you show the baby because sometimes these may be because of fluctuating blood pressure, a fall in blood pressure. That is why the child is feeling unusually tired and wanting to lie down. So a running around child, playing child is definitely more reassuring than a child who prefers to lie down and looks very tired and sick. It's one way of telling you, I'm not feeling well, I'm sick. So better get the baby assessed. Are there pointers to where the site of infection is? Like they might touch the ears and cry, they may have a runny nose, they may not be eating well. It's a child drooling more. If you have a throat pain, the child will salivate more. Refuse food. Baby is hungry, comes to the food, but then after that doesn't eat. So it must be paining somewhere in the throat. So again, look at the chest. Do you find a fast breathing? Do you find any labored breathing? A persistent fast breathing. In between that fast breathing is there, then it comes back to normal, that's okay. But a persistent fast breathing, if there is labored breathing, like you see in the asthmatic patients. So here you will find there is a lot of indrawing in the neck and the sides of the chest. So please watch the neck area and the sides of the chest and see if there is a labored, sometimes you can see sort of movement like that and indrawing. So these sort of things, a fast breathing, a labored breathing, poor activity, fever uncontrollable, decreased urine output, and a progressive worsening in any of these conditions. Okay, like a child was active yesterday, today is less active. So if and each day there is a worsening. Appetite, 3 days back child was eating less but still okay. Yesterday it was even worse, today it's getting worse. So if you find a progressive worsening, also you should check the child for reassessment. Of course, when you have fever, everyone will eat less, but usually it stays at the same level. Started eating less and it stays like that, after 3-4 days comes back to the normal. But if it's worsening each day, fever worsening each day, initially the fever was every 12 hours, then it became every 8 hours, then now it is every 4 hours, there's a worsening. Small spikes of fever initially, which was just 38. Next day it just became 39, now it's becoming 4. So worsening fevers, worsening activity, worsening food intake, all these are more concerns than something which is static. Because in viral infections, you can have all these symptoms for 2 or 3 days. So most of the time, viral fevers can last for up to 5 full days, from around about 120 hours. So if they are active and playful, eating well, happy, then you can be more reassured. High fever, chills and rigor can often be with urinary infections also. So you may have to investigate more if the child has higher fever. A smaller baby will need more investigations for a fever than probably an older child because of the risk associated with a small baby and the difficulty to control the infection by the baby. So baby is more immunity has not yet developed in the young ones, so you may have to do more investigation, urine, the blood tests, even the spinal fluids, all these may have to be tested in a small baby less than 2 months of age. This is to give you an idea about how to manage when you face a child with a fever at home. This is not a substitute for medical assessment and proper treatment. Hope this will be useful for you.